on in.
Hi, Melanie.
Hi.
Hey, my name's Sarah Wise. I'm going to be your healthcare provider today. How are you doing?
Good. Thank you. Nice to meet you.
Good. Nice to meet you too. Thanks for coming in today. I'm just going to be doing a physical exam on you. So I'm going to run through some questions, a series of questions, and some tests with you. Just let me know if at any point you're uncomfortable. I'm going to give you the strape right here. That's just to keep you from being exposed unnecessarily. Um, So I'm going to go ahead and get started. The first thing I'm going to do is tell you 3 words that I want you to remember, okay?
Okay.
I'm going in a few minutes after we've done some other stuff. I'm going to ask you to recall them to try and remember them.
Okay.
Dog, green, cactus.
Okay.
Can you repeat them for me?
Dog, green, cactus.
Okay, good job. All right, and now can you tell me your name and date of birth?
Melanie Cardwell, 11/10/1974.
Okay, and what's today's date?
6/19/2021.
Okay, and do you know who the president is?
Joe Biden.
Yes, and what building are we in right now?
We're in your private practice facility.
Okay. The while I'm doing all of this, I'm just taking in a general survey of her appearance. I'm noting any obvious abnormalities, any body odors, anything, her affect, whether she's calm, whether she's agitated. She is alert and oriented ×4. She's answering questions appropriately. Her speech is good. She hasn't stuttered or had any issues with anything. So I'm going to continue on by asking you if you can repeat the 3 words that I asked you to remember.
Dog, green, cactus.
Good job. You passed your first
Yay!
All right. So the first thing I'm going to do is take your vital signs. Are you having any pain today?
No.
Okay, great. So on a scale of 0 to 10?
0.
All right, perfect. I'm going to take your blood pressure. And let me borrow your finger. Can you hold your arm out? I'll help you hold it. Okay, temperature is normal. I'm just going to listen to your trachea real quick, okay? Breathe in and out for me. Good job. All right, blood pressure is 115/73 with a heart rate of 83. That's perfect.
Yay!
That's a really good blood pressure.
Passed my second test.
I mean, you're starting off good here. Oxygen saturation is 98%. And your respiratory rate was good. Sounds good at your trachea, okay? I'm going to go ahead and do an inspection of your skin. In a hospital setting, she would have a hospital gown on, which would give me a little bit better access to see all of her skin. But for her privacy on camera, I'm just using the best that I could do with a gown. But I'm going, sorry about that. I'm going to take a look at her skin. I'm going to check her whole back. I want to look at her whole torso, her upper extremities, lower extremities. And I am looking for rashes. I'm looking for any abnormal moles. I'm looking for any lesions, scars, wounds. I'm checking the pigmentation of her skin. I want to look at the turgor. So I'm checking hydration, looking for any tinting. I'm going to look at the top here. I'm looking at hair pattern growth on her arms. All right, looks good. I'm going to look at her nails. I'm looking for any signs of cyanosis, any signs of clubbing, any fungal infections. I'm looking at capillary refill. It's a really easy time to do it. And then I'm going to look at your abdomen area, which I will inspect closer whenever I'm doing the abdominal exam. I'm checking out her legs and knees. Are you having any pain or anything anywhere?
No.
Any problems anywhere?
No.
I'm going to check the bottoms of her feet, especially for diabetic patients, because they could have wounds or ulcers that they're not even aware of. And I'm looking at her toes for cyanosis, for any fungal infections. She doesn't have any. So I can redrape you here. I'm going to go ahead and start looking at your scalp. So I ask you to recall those words yet? Did I remember to remember? Yeah, that's
Yes.
the first test you passed.
That made you remember them again.
That was my turn. All right, so I'm just gonna put some gloves on. I'm looking at your scalp, and your hair. I'm looking for any parasitic infections. Thank you. I'm looking for hair growth pattern. I want to look for any alopecia, any signs of anything like that. I'm looking for symmetry between the head, on the sides, both sides, and the front and back. I'm also going to palpate it. Just tell me if you have any tenderness. I'm feeling for any lumps, any indentations around the scalp. Anything hurt there?
No.
Feels good, doesn't it?
Yep.
All right, good. Now I'm going to go ahead and start with looking at your face. So I'm looking at the skin on the face and the lips. I'm just looking for pigmentation. Thank you. All right. I'm going to palpate your frontal sinuses. Are you having any tenderness there?
No.
Okay, great. And what about on your maxillary sinuses? No. Okay, and I'm going to feel your temporal arteries. They're good. They're about a 2+ bilaterally. I'm going to feel right here. Can you open your mouth and close your mouth a couple times for me? I'm just listening for or feeling for any clicking that might indicate you have TMJ. Good job. Now, can you clench your teeth together for me? Do that a couple times for me. Okay, great. And can you smile real big and frown? And then raise your eyebrows up, clench your eyes shut. And then can you blow your cheeks out? And can you stick your tongue out and move it side to side? Good job. All right. I'm going to go ahead and look at your eyes. I am looking at them on the outside, the periorbital areas. The sclera is nice and white. I don't see any signs of jaundice or erythema. I'm looking at the conjunctiva. They're pink and moist. Have any issues with your eyes? No. Okay, great. I'm going to go ahead and do an eye exam on you, a vision exam. I'm getting about 6 feet away.
Okay.
Are you wearing corrective lenses?
I am.
Okay. I'm going to ask you to read the smallest line that you can with both eyes.
LTFPH.
Good job. And now can you cover your left eye for me? And with your right eye? Sorry, I'm being.
Thank you.
It's okay. Here's the side. You got it?
Thank you.
I'm only taking one of your arms away.
No, everything fell apart.
Okay.
LTFPH.
Good job. And then can you cover your right eye for me? And what's the smallest line?
EPTZO.
Okay. So your vision with both eyes is 20/20. Your right eye is 20/20. Your left eye is just a little bit off at 20/30.
Okay.
Okay. Now I'm going to check your peripheral vision. So I'm going to put my fingers together here and I'm going to take them apart. Just tell me when you stop seeing them, okay? Okay, good job. That's just checking your peripheral vision. I'm going to dim the lights real quick. All right, if you can look at a point on the wall right there, I'm just going to check your pupillary responses. Okay, great. They're reactive and equal bilaterally. I'm going to take the pen light here, kind of stare past it at the wall. But when I move it in towards your nose, I want you to follow it in with your eyes, okay? I'm just checking for any nystagmus, strabismus. Good. And I'm going to check your cardinal field of gaze, okay, your 6 field of gaze. So don't move your head, but just use your eyes to look at all the different places. All right, gaze is steady. No abnormalities noted. Good. Now, I don't have an ophthalmoscope, so I'm going to use my otoscope to do a fundoscopic exam or replicate one. I'm going to be looking at the inside of the eye. I will look at the retina. I want to look at the disc and check out the margins of each eye. Now I'm just gonna turn the light back on real quick. All right, and now I'm going to look at your ears. So first, I'm just going to look at the outer ear. I'm looking at the external ear canal. Now I'm going to take a look at the inside, okay?
Mhm.
I'm going to pull the pinna up and back. I'm looking at the tympanic membrane. It's gray and pearly, intact, and the cone of light is at 5 o'clock. I'm going to check this ear. Looking at the outside of it, the external ear canal looks good. I'm going to pull the pinna up and back and look inside of the tympanic membrane. And it looks good. It's gray and pearly. Cone lights at 7 o'clock. I won't throw stuff around. Now I'm going to do what's called a whisper test. And a couple other hearing tests, okay? Can you cover up one ear for me? I'm going to whisper a word on this side. Just repeat it for me, okay?
9,
Yep. And I'll do this one. 3. Good job. Now I'm going to do the Weber test. This is going to be an instrument that I use for it. You're just going to tell me if the volume of sound sounds equal in both ears or if it sounds louder in one ear than the other, okay?
the same.
Okay, good. Now I'm going to do the rhyme test. I'm going to hold it up to your ear and just tell me when you stop hearing the sound.
Okay.
Okay, great. That was 17 seconds. I'm going to do it again. Okay. Now I'm going to check your other side, okay? Okay, great. All right, now I'm going to take a look at your nose. It looks midline, looks good. Do you have any prior injuries to your nose or any issues going on and have a runny nose or anything? No. All right, so I'm going to take a look at the inside. I'm looking at the nares. They're not inflamed. She doesn't have any rhinitis. The septum looks intact on both sides. So I'm going to check your olfactory nerve. I want you to close your eyes and identify the smell that I'm going to hold up to your nose, okay? Peppermint. Yep, that's it.
Smells good.
No, it does smell good. All right. So now I'm going to take a look at your mouth. So I'm going to inspect your mouth for a multitude of reasons. One is because this is where we see any initial signs of cancer. I'm going to look for I'm going to look at your buccal mucosa, make sure that it looks like it's good and pink and moist like it should be. I'm going to look at your uvula to make sure it's midline. I'm going to look at your hard and soft palates. Go ahead, sorry. I'm going to hold your tongue down. Can you say ah? Ah. Good job. So there was no, her speech was smooth with that. Her tonsils, I'm grading them. The uvula is midline. I'm looking at the buccal mucosa and dentition. Do you have any teeth problems with your teeth right now? No. Okay, great. All right, and I'm looking for any lesions, the color, moving her tongue from side to side. Great, and then up. Okay, and down. Okay, perfect. Can you stick your tongue out and move it side to side for me? All right, now I'm going to check your gag reflex, okay?
Oh, yay.
Sorry. I'll do a light. Got it. Good. That's a good sign.
Yay. Great.
All right. So now I'm gonna go ahead and inspect your neck. But before we do that, can I push down on your shoulders? Can you shrug your shoulders against my hands? Good job. And then can you do your head back and forth and then just up and down for me? All right, good job. Now I'm gonna take a look at your neck. If you can just look up for me slightly. I'm just looking at the trachea. Want to make sure it appears midline. I don't want to see any evidence of goiters, any lumps, anything like that. I'm looking at the carotid pulses on both sides. Now I'm going to palpate the carotid artery individually. Oh, they're good. 2+ on that side. 2+ on this side. Looks good. I'm going to go ahead and feel your lymph nodes. Are you having any? You just let me know if you have any tenderness of any of the areas. I'm going to start with your preauricular here. I'm going to go to your postauricular over the mastoid process. And then I'm going to go to the occipital. Any tenderness? All right. I'm going to feel the deep cervical. All right. Anything here?
No.
And what about through here?
No.
Okay, and I'm going to feel your tonsillar. Nothing?
No.
And then I'm going to test up here to your submental. Any kind of tenderness up there?
No.
Okay, great. Can you raise your arms for me? I'm just going to check your axillary nodes and your armpits. Do you have any tenderness there?
No.
Okay, great. Now I'm going to listen to your carotid arteries.
Okay.
I'm listening for any bruits, frills, heaves. So I'm going to listen with my diaphragm. Okay, and my bell. All right. Okay, great. Now I'm going to pause the video really quick so that I can change your position, okay?